If you are over 60, take calcium, and still experience hip or back pain or notice that your bones are getting weaker, today I want to explain why this happens and what you can do so that calcium actually reaches where it needs to go. The problem is not always the amount of calcium, but how your body is able to fix it into the bones, and that is exactly what we are going to talk about today. I am Dr. Gabriel Mena, and I welcome you to my channel. Here we talk about integrative health, longevity, and natural, very simple habits that help you maintain physical, mental, and emotional balance. Take note and share this information with your family and friends to help them improve their health. We upload new videos every day, so subscribe and turn on notifications so you do not miss any updates. Let's get started. When we mention calcium, almost everyone immediately associates it with bone health. We think of strong bones and often believe that by consuming foods that contain calcium, such as dairy products, the body will easily absorb it and send it directly to the bones. This idea is very common, but in practice it does not always work that way. The reality is that calcium, by itself, does not automatically become fixed into bone structure. For this process to occur, the body needs a specific vitamin that many people no longer consume. Why does this happen? Because we have stopped eating certain foods out of fear, misunderstood recommendations, or the bad reputation they have been given over the years. A very clear example is butter, which is an important source of vitamin K2. Vitamin K2 plays a critical role. It allows the calcium you consume through your diet to actually become incorporated into the bone matrix. When this vitamin is low in the blood or simply not included in your diet, calcium cannot be fixed properly. That is why today I want to help you understand why it is so important to rebuild a healthy relationship with foods that many people have eliminated unnecessarily. Butter is one of those foods. Many people stopped consuming it because they heard it raises cholesterol, increases blood fat levels, or causes cardiovascular problems. However, when used correctly and understood from a molecular nutrition perspective, it can become a true ally for bone health, especially when there are osteomuscular problems, microfractures, or injuries that require specialized care. This leads to a very common question. Is it possible to improve bone health using vitamin K2 from butter? The answer is yes, as long as it is used properly, its molecular group is understood, and most importantly, the real reason why calcium is not being fixed into the bones is identified. Let me give you a very common example. Many people prepare a plate with yogurt, fruit, and seeds, thinking it is ideal for someone who has suffered a fracture or injury, believing this will help the bone heal faster. But in many cases, the opposite happens. Recovery becomes slower and more difficult because the fat needed for calcium to do its job is missing. On the other hand, when people see a simple meal like bread with butter and an egg cooked in butter, fear appears. They think it will cause a heart attack, spike cholesterol, or lead to negative consequences. However, this combination is one of the most effective ways to provide vitamin K2, which is essential for calcium to truly fix into the bones. I am Dr. Gabriel Mena, a physician in my early 50s, and my goal with this content is to help you first and, through you, many other people. I have seen this scenario many times in my practice. I clearly remember a patient in her early 60s who had been taking calcium for years and still suffered from constant hip and back pain. When we adjusted her nutrition and she understood the importance of fats and vitamin K2, her progress began to change in a clear and steady way. If this topic is making sense to you so far, I invite you to subscribe to the channel, share this video with someone who may be going through something similar, and leave a comment. That way, you help this information reach more people who truly need it. Today we are going to go deeper into the role of butter, vitamin K2, and why these elements, feared for many years, can become essential allies when osteoporosis, osteopenia, fractures, or difficulty recovering bone mass are present. Learning how to properly use food molecules makes an enormous difference in these processes. As always, we will begin by making space for real questions from people who write to us. Their experiences help us better understand what is happening in the body and find clearer, more practical solutions to protect bone health over the years. If after 60 you notice that your bones do not recover well, that surgery takes a long time to heal, or that a fracture does not seem to consolidate, it is important that you understand this. Without vitamin K2 and without sufficient protein, calcium simply cannot be fixed into the bone. That is why many orthopedic procedures do not achieve the expected results, not because the surgery was poorly done, but because the body does not have the proper nutritional state to respond. For this reason, it is essential to understand how vitamins work, especially vitamin K. This vitamin is not only involved in blood clotting, as many people believe, but also plays a key role in bone metabolism. Different forms of vitamin K2 help activate a very important substance called osteocalcin, which regulates the balance between the cells that break down bone and those that build it. In bone tissue, there are two main types of cells. Osteoclasts are responsible for bone resorption, and osteoblasts are responsible for forming new bone. Vitamin K2 is essential for these cells to work in an organized and effective way. This active vitamin is obtained in only two ways: through healthy bacteria in the colon or directly from fat-rich foods that already contain it in its active form. That is why we say vitamin K is a fat-soluble vitamin, meaning it needs fat to function. Along with it are vitamins A, D, and E. It is important not to confuse vitamin K2 with vitamin K1, which is often restricted in people taking anticoagulants. These vitamins have different functions, and this distinction makes a major difference in bone and cardiovascular health. We often see people with elevated calcium levels in blood tests, both total calcium and ionized calcium. They are then told to avoid dairy and any calcium-containing foods. But here lies a serious mistake. The calcium showing up in the blood does not come from what they are eating. It comes from the bones, which are demineralizing and releasing calcium into the bloodstream. That calcium should return to the bone, but for that to happen, vitamin K2 is required. When this vitamin is low, calcium is lost through urine, eliminated in stool, or deposited in the wrong places, such as the arteries. This is why osteopenia and osteoporosis do not only affect bones but also silently increase the risk of cardiovascular disease. When I see in my practice a thin person with low body weight, osteopenia or osteoporosis, and low vitamin D levels, my first concern is not just a future fracture. What truly alerts me is the possibility of an undiagnosed blocked artery. This is rarely explained to patients, which is why many spend years without understanding what is really happening in their bodies. For more than a decade, there have been solid studies published in high-level scientific journals showing that vitamin K2 acts as one of the most important cofactors in preventing plaque formation in the arteries. When a person does not have enough vitamin K2, either because they do not consume it or because their gut microbiota is damaged, inflammatory processes are activated. Combined with calcium released from bone, this becomes a real risk for heart health. This explains why many people with osteoporosis, sarcopenia, and low body weight end up developing cardiovascular problems, even when they do not appear to have obvious risk factors. I have seen patients who said they had avoided fat for years and still developed arterial calcification. When we reviewed their history, we found accelerated bone loss and a diet deficient in essential fats. For a bone to repair itself after a fracture or surgery, having calcium available is not enough. A complex cellular process is required, and this process depends on vitamin K2. When an injury occurs, the body activates mechanisms for osteoblasts to form new bone, but these cells cannot function properly if this vitamin is lacking. When vitamin K2 is insufficient, bone fails to mineralize properly, and calcium ends up being deposited in soft tissues, especially the arteries. That is why this vitamin is so important in people with cardiovascular disease, stents, or who have undergone revascularization procedures. Paradoxically, these individuals are often advised to remove fat from their diet, which only makes the problem worse. I have accompanied patients who came out of shoulder or hip surgery, took antibiotics, removed fat from their diet based on general advice, and then struggled to recover. I remember the case of a 68-year-old man who, after knee surgery, continued to experience pain and stiffness. When we reviewed his diet, we saw that he had completely eliminated both fat and protein. Once this was corrected, his recovery began to improve clearly. Our bodies need all molecules: carbohydrates, proteins, and fats. The goal is not to eliminate them, but to understand them and use them correctly. Butter, for example, is not just fat. It contains vitamins A, D, E, and K2, as well as short and medium-chain fatty acids and compounds such as conjugated linoleic acid, which help reduce inflammation and protect bone. When we remove fat from the diet, we favor the action of the osteoclast, the cell that breaks down bone. This shows up on bone density scans as porous bone with spaces, what we know as osteoporosis. The body tries to slow this process not only to prevent fractures, but also to protect biochemical and cardiovascular balance. Scientific evidence shows that butter, especially when used properly, supports bone mineralization, improves joint lubrication, and aids recovery after trauma or surgery. That is why a person recovering from hip, shoulder, or knee surgery should not be deprived of fat, but rather taught how to use it correctly. Another key point is the gut. The colon houses bacteria that help produce vitamin K2. When a person receives broad-spectrum antibiotics, as often happens after surgery or cancer treatments, that microbiota is destroyed. Without those bacteria, the body loses a fundamental source of vitamin K2. I have seen patients who survived cancer, received antibiotics, eliminated fat and protein, and a year later suffered a cardiovascular event. This was not a coincidence. It was the result of sustained bone loss, inflammation, and poor calcium fixation. When the gut is healthy and populated with the right bacteria, beneficial fatty acids are produced, inflammation is reduced, and bone formation is supported. In addition, the absorption of minerals such as calcium, phosphorus, and magnesium improves, all of which are essential for maintaining strong bone structure. That is why when osteoporosis or osteopenia does not improve, the cause is often not a lack of calcium, but rather a deficiency of vitamin K2, a damaged microbiota, and an unjustified fear of fat. Butter, when properly understood and used, can be a very valuable tool in this recovery and balance process. When you reach 60 or older and notice that your bones do not recover well, that a fracture takes a long time to heal, or that you have been told you have osteoporosis or osteopenia, the problem is almost never a single food, but how you are using what you eat. That is where today I want to help you find a practical and clear solution. Many people tell me, "Doctor, if I eat butter, my arteries will clog, my cholesterol will go up, I will be scolded." And I want to tell you calmly, the problem is not butter, the problem is how it is used. Look at a very common breakfast: bread, oatmeal, a dairy drink, jam. In that context, butter is not the culprit. What truly causes harm is the disorganized combination of many carbohydrates at the same time, what we call molecular convergence. This blocks the real benefits of vitamin K2 that is actually present in butter. It is also important not to confuse butter with margarine. Butter comes from cow's milk and is obtained through a mechanical process that concentrates fat and fat-soluble vitamins like K2. Margarine, on the other hand, is a vegetable oil that has been solidified through industrial processes. Although both are fats, they do not have the same effect on your body or the same biochemical value for your bones. Another common mistake is thinking that vitamin K2 is obtained only by eating fiber or vegetables. Vegetables provide vitamin K1, but K2 depends on fat and also on having the right intestinal bacteria. If you do not have those bacteria or do not consume fats, that K2 simply does not form. That is why many people who avoid animal-based foods or fats end up with increasingly weaker bones, even though they believe they are eating healthy. I have seen many cases like this. People who come out of surgery or a fracture and do everything right, according to what they were told: yogurt, fruit, seeds, oats, supposedly anti-inflammatory foods, all together on one plate. The result is that inflammation does not go down and the bone does not recover. I clearly remember a patient who came to my office after several months on crutches. He had seen multiple specialists, and no one understood why he was not healing. When we reviewed his diet and nutritional levels, the problem was clear: he did not have the nutrients or the proper structure to fix calcium. We adjusted that, and the change was evident. Molecular convergence occurs when, without realizing it, you combine many different carbohydrates in a single meal. Each one is absorbed in a different part of the intestine, forcing your body to release insulin multiple times in a row. This hyperinsulinemia keeps inflammation active. Exactly the opposite of what you need to repair bone, fix calcium, or protect your arteries. When you use butter properly as a fat, without mixing it with multiple carbohydrates, the body's response is completely different. This is what we call molecular gold, a simple plate that includes one fat, one protein, and one carbohydrate. For example, bread made from a single type of flour, real butter, an egg cooked in that same butter, and a beverage without added sugar. It is not complicated, it is not expensive, and it is something you can do today at home. This is not about eating less or fearing food. It is about learning how to use it, teaching your body to receive the right molecules in the right order so it can do what it knows how to do: repair, strengthen, and balance. When we evaluate a person after a fracture or surgery, we do not look only at the bone. We look at body composition, minerals, vitamin D, and vitamin K2. I remember the case of a 71-year-old patient with a hip replacement. He appeared to have normal weight, but had significant bone mass loss. By adjusting his diet and eliminating molecular convergence, we were able to improve his body composition and strengthen his bone, even at that age. It is possible when done correctly. So I want you to take away this final message. Butter, when used properly, is an ally in fixing calcium into the bones thanks to vitamin K2. Fats are not the enemy, they are necessary to absorb essential vitamins. Cardiovascular disease cannot be explained by fat alone, but by much more complex inflammatory processes. Removing fats without understanding the root of the problem often makes the situation worse. Now that you have this information, use it first to take care of yourself and then share it with those you care about. Many people are going through the same thing and do not know why they are not improving. If this content is helping you, I warmly invite you to subscribe to the channel, turn on notifications so you do not miss the new videos we upload every day, leave a comment, and share this video with someone who needs it. That helps us continue reaching more people. And before we finish, I invite you to take a brief pause and thank God for life, for your body, and for the opportunity to learn new things that can help you live with greater health and peace of mind. Knowledge is also a form of care. On this Dr. Gabriel Mena channel, we are very happy to accompany you, to contribute to your well-being, and to help you improve your habits day by day. Tomorrow we will have a new video prepared with great care for you. We will be here waiting for you, because your health and your life truly matter to us.